pleased and happy I am to be here. I went to a school and, you know, every once in a while, within 5 years of us leaving school, we had 2 people who committed suicide. And the fact was that we'd all go to the funeral most of the year, and you would think, you know, the comments were always the same. We never imagined that this particular person was in harm or was under stress. And, you know, if only we'd known, we could have done something. But the fact of the matter is those services didn't really exist 2 decades ago. We weren't as aware of mental health as an issue. And as I say that, of course, some of these services didn't exist even a year ago. And so I'm really very pleased to be able to stand here in front of you today and to be part of this program that is creating so many services so that no one has to go to a funeral of a friend, a colleague or a loved one ever again because we just didn't get to them in time, or we weren't aware that they were under stress. So having said that, I will now read my authorised speech. To Ms Lynelle Hales, Dr Magda Campbell, Mr David Grant, Mr Craig Parsons, staff of the Sydney North Primary Health Network and guests. Thank you for inviting me here today. One of the great privileges of being a Member of Parliament is hearing every single day about the amazing work being done to change individual lives. Since coming to office, I have been impressed by the number of organisations working to improve services for those suffering from mental illness, from national organisations like Beyond Blue, Headspace, RUAC, BATA, and even the Northern Beaches Veterans Centre, to local organisations like our very own Community Connect Northern Beaches here in Mona Vale. Today I announce 6 new providers of mental health and suicide prevention services funded by the Australian Government for residents in Northern Sydney. It is estimated that more than 4 million Australian adults experience mental ill health each year, and locally that's 12 in every 100 people. Tragically, in 2015, 3,027 Australians took their own lives. That's more than 8 people every single day, 1 person every 3 hours. 75% of these people were male, making suicide the 10th leading cause of death for men in Australia. For young people, it's even worse. Suicide is the leading cause of death for young people, accounting for more deaths than car accidents. And these rates are at the highest level they've been in 10 years. The effects of this loss are felt by all of us, friends, family, and our community. Death by these figures are only the tip of the iceberg. For every death by suicide, it is estimated that as many as 30 people attempt to end their lives. That's 65,300 suicide attempts each year. For their family, for their loved ones, each attempt marks the start of a struggle to find the support and care they need to recover. The services I announce today cover early intervention, low-level mental health care, wraparound support to connect vulnerable groups to the services they need, and support for those who have tried to take their own lives. Critically, these services are innovative, culturally sensitive, and already on the ground to ensure that people get the right help at the right time. The Turnbull government has made mental health a national priority and is leading a transformation in the way mental health care is delivered in Australia. It is clear that if we as a community are to properly tackle the challenges of mental health, ambitious reform is necessary. Pivotal to this is locally planned and commissioned mental health care, delivered through a primary health network. These take existing fragmented services and integrate them to better care with a focus on the individual needs of each person. In order to achieve this, the government is moving to a step care model, refocused to provide the right care where it's needed, when it's needed, shifting the focus away from crisis care to early intervention, and importantly, prevention. This year, over $4.2 billion will be invested in mental health through direct and indirect services, with a key focus on frontline services. Our government has allocated $14.2 million to the Northern Sydney Primary Health Network through to the end of June next year to commission mental health services that best support the needs of our community. The new services have been commissioned by the Northern Sydney Primary Health Network, which has undertaken extensive research and community consultation to understand the specific mental health needs of our region. All the services being announced today have been identified through a competitive tendering process as the best suited to meet our local needs. For years, successive governments have been trying to respond to the issue of mental health and in particular suicide prevention. The truth behind the figures I mentioned earlier is that we have barely moved the needle. The solution is not to be found in throwing more money at a mental health problem. Rather, it's about making sure that we get the best possible outcome for our residents. The decisions are being made here, on the ground, because that's how we will get the best results. Here today, amongst all of you, who work day in and day out for those with mental health illness, I am so thankful for all the work that you do. This government is committed to supporting you and supporting those struggling with issues of mental health. I personally will continue to fight to ensure that those on the northern beaches with mental health issues can gain easy access to the support they need. Thank you.